It's a gloomy day outside, lots of rain, kind of cloudy, not a good day for sun, but it's a really good day to blue light. Hi, I'm Kerry. You might have seen me before on one of my Kicking It, well actually this was pre-Kicking It with Kerry. This was my Blue Light video, which is on YouTube. And we've been using it as kind of education for patients for the last, I don't know, 4 or 5 years. I've been doing blue light yearly because I keep having actinic keratoses, and it helps to reduce future basal cell or squamous cell carcinomas, and I really don't want to have Mohs. So that's why I keep doing it. The weather, it's raining right now. There's a cancellation on the schedule, so let's go. All right, so it's time for me to do blue light again. I have been blessed with Irish skin, and I'm very fair, and I am continually getting these actinic keratoses. So several years back, I did my first blue light video, and so it's time to renew it because although the procedure hasn't changed too much, there has been different types of procedures that have come along. So today we're going to be doing a 20-minute incubation and then 20 minutes under the light, whereas before I did 2-hour incubation and then 15 minutes under the light. Depending on your provider, you might do 3 hours of incubation, 1 hour under the light. I am a delicate flower, so we have found that I get really swollen, I get really red, and I have like kind of dramatic results. Now, Lizzie is one of our physician assistants. She did blue light for me last year, so I asked her to do it again. And the weather is perfect. We're into this winter weather right now. It's gloomy, it's rainy, perfect for blue light weather because I have to be out of the sun, right? And I'm certainly not going to look good for the next couple days, right?
48 hours, no sunlight.
48 hours, 0 sun. Lizzie, I understand this is a field therapy treatment, right? Yes, we're going to tackle those actinic keratoses, but like, how does it help me and my future self, my future skin?
So blue light is to, as Kerry said, be more of a field treatment when someone has several actinic keratoses or precancers. By treating those, we're lowering the risk of those turning into an actual skin cancer. So precancers can turn into squamous cell carcinoma, and we're wanting to reduce that risk. So instead of just spraying each little individual spot with liquid nitrogen, this is a great option so we can treat the entire face and lower that risk by a good amount.
So basically the hope is no cutting, right? Nobody wants to have Mohs.
Yeah, no one wants a scar on their face.
Yeah. So hopefully we can treat the AKs before they become SCCs or BCCs, and then we don't need to be cut. So I'm washing my face, and then I'm going to do a polisher to get like the top layer of skin off. I think that's why I'm doing it. I'm only doing it because that's what I was told to do, but
it's good to kind of rough up the skin and get it pre-treated for the blue light.
So that the medicine absorbs better?
We'll do the acetone scrub too, which will degrease the skin so that you can better absorb the Levulon.
So much fun. So much fun. Okay, so here's my cleansed skin. Beautiful. Now I'm doing the polisher. I was asking Lizzie because I had been treated with liquid nitrogen on my lips and my face if this was going to be a problem. She said, no, it's just, we'll treat it even better.
Yeah, you healed well, so.
Yeah, I've noticed, like, you know, because like look how my arms are right now. Here is where I have all my skin cancers on my arms. Is this fun? Are we having fun yet? I think we're having fun. I feel so clean. I feel so refreshed. Why am I putting myself through this torture again? I think
because it's what's best for you.
Because it's what's best for me.
She's very red from scrubbing.
Well, you know,
she's sensitive.
I'm sensitive. I also was thinking maybe this would be something good to show, but like this was a precancer, and sometimes people are like, I don't know if it was supposed to look like this. It's totally normal that, you know, sometimes a little blood blister would develop around the sprayed area, but the little white center part, you can see that's the skin cancer coming to the surface. She looked good.
What? You gotta just do full face.
I want some hot stuff, baby, this evening. I need some hot stuff, baby. Got to have some hot stuff. Got to have some love. Good? Am I excited? Not at all. To be honest with you, not at all. I mean, this is not the sort of procedure that you look forward to doing. It's kind of like you have to do it because I don't want to get cut. And I usually get a nice cosmetic benefit, a little glow up, a little evening of the skin, which is nice. So I'll try to just look forward to that part.
So we're doing the acetone scrub now. I know we said it earlier, but we need to completely degrease the skin. And so we do that with acetone and gauze. The smell is not pleasant, but it is a really important step.
Yeah, it's so weird to think that the chemical that you use to take off your nail polish is what you're putting on my face right now.
Yep. Sorry. Let us know if you need a breathing break.
No, go for it. So we're wiping off the amalus. It had sat on for 20 minutes. Got to get it all off. Okay, let's go.
Ready? We're going.
Like, was more uncomfortable taking off the acetone than the light is right now.
This is a generous amount of Sickle-Fate.
Although I don't feel like as hot as I have for other, like not even close. Like normally when I do this, I'm really stingy. It's like feels like a bad sunburn. It feels wrong in every way. It's like, how could this be good for my skin? But like this was comfortable. There was, you know, it was just slightly warm. It felt like a nice hug. So I'm really hopeful that this technique is successful. I'm gonna put this sucker on. It's got this little filmy thing. I've never done this kind before because I don't know why I haven't done these, but it takes like a master's degree to figure it out. Like what? This goes to the top, I guess? Okay, so we're gonna, normally, what is this? Normally there's little eye holes, neck and décolleté mask. So that's why it's not right. Oopsie. So maybe we'll just, I don't know. So normally you'd be able to see, but that's fine. I'm gonna just, I can still breathe, sort of.
This is the mask I bought. This is the film.
Yeah, normally that, like it's a film that comes off, yeah, like that. Ah, much better.
Okay,
Okay,
we're done.
10 minutes. Feels much, no stingy, calmer. Like I can't see my chin, my cheek here, like the swelling does seem like it's gone down.
It looks good.
If it helps. I know. I think that a nice even result, right?
Yeah, it looks really good. How did you, I mean, I think that's a good protocol to do.
Yeah.
Because it was fine under the light, right?
It was totally comfortable under the light. Yeah, no problems under the light. It felt just like
Behind the scenes.
just warm. So when you're this red, my face is hot, and it's kind of stingy. It's not awful. It's better than last time. So that's why I want to use that really gentle cleanser. Okay, thought I was recording. I missed that whole thing. Some great content, but anyway, basically I did what I just almost did. I'm putting on Sickle-Fate right now. Yeah, there it is. Sickle-Fate. It's very calming. I'm also gonna brush my teeth. Oh, that's right, you guys don't need to see that. Okay, so we're on day 2, you guys. It's not pretty. I'm swollen. I'm, got this collection of liquid under my eyes. I'm very red, just a little bit stingy, I guess, a little bit stinky, stingy. I have been using a little ice roller thing that feels really good. But I didn't start doing that until this morning, which I probably should have done that last night going to bed. So I just washed my face with the Zeracom and it feels good. And now I'm gonna put some of the Sickle Fate on. Oops, that's the wrong way, this way, it's the right way. So I'm just gonna put this on and then I'm gonna lather up with some sunscreen. And then I'm gonna continue putting this on throughout the day. This is the thing I've been using. Sorry, Kate, she's gonna kill me. It's my daughter's, but oh, so I took it out of the freezer. It feels so good and it's helping with the swelling. I am on fire. This girl is on fire. Burn, baby, burn. The good news is really decreases your makeup routine time because there's no point in even trying to put on makeup, right? Like you're not gonna look better or good. So I used this tinted sunscreen, Glow, and it just calmed the redness down. And then I think it's important maybe to make my eyebrows pop because they just sort of blend into the redness. So I'm gonna work on my eyebrows a little bit. I'm gonna wear my hair down so that I have extra protection while I'm driving to work, put on a hat, and off I go. Work. So day 2, I put on makeup and I think I pulled it off, but you'll see once I take the makeup off, I'm still really red. Trying to think of a song I could sing to you guys. Now you can see with the makeup off, I'm still pretty red, and you can see sort of like the deeper red spots. Those, I'm told, are all the AKs coming to the surface. So I needed to do this. This side doesn't look as bad. Maybe this is the side of the driver's seat. Okay, so still swollen. Starting to peel, so you can really see the peel when I've got some tinted moisturizer on. I just put the Sickle Fate on, this stuff, which I love. Last night I used some of this, the moisturizer, which I'm not even sure if we sell it anymore, but the it's a little less than Aquaphor, but a little more than the Sickle Fate because the peeling started. Still red. Okay, so it's Sunday, so we're 6 days out from doing the Blu Light, and to look at me from a distance, you can't really see too much peel, but when you feel in close, there's definitely some peel. It's not bad though. And then I'm red, a little uneven, splotchy. Let's call it splotchy, but so much better. And with makeup, or a little peel there too. With makeup, I look good as usual. Okay, so I wanted to check back in with you guys. It's Wednesday. I did the Blu Light a week and a little bit ago, so 10 days ago. My peeling is done. I still have some residual redness, and this is just from sleeping, but I just washed my face. I used the Bright and Clear first to just kind of get rid of any of the peel. And then I used this Aven Gentle Cleanser. And I used this Epicutis serum. And then I used this Epicutis moisturizer. But like last night going to bed, I still used the Sickle Fate. And I could have used this today if I wanted to. I've been using the Elastin Skin Recovery, which I could probably put that on. I could have done the serum and then this and then the moisturizer. Lots of options. Just you want to be gentle. You want to kind of be exfoliating. If I had used the Epicutis cleanser with the scrub here, I could have done these two, which would have been a good solution. But I'm just going with basics, gentle, hydrating to get me back to normal. Get mic'd up. Quiet on set. So Mandy wanted me to wrap up. Now, gosh, today is February 21st. I did the procedure when? Like a month ago. I was really bad because on Saturday of this week, I actually got a sunburn and crazy. So you've got new skin after this. You just have to be even more careful when you're out in the sun. But I have noticed a dramatic improvement in my skin's splotchies. I just rewatched the video that you guys watched. Thanks for all your patience and sticking with us. If you're still here, I can't believe it. But there was lots of, redness. Now I do have some makeup on, but my skin is much more even toned. I don't have all these red dots everywhere. There's none. I mean, maybe one or two, but hardly any. And the texture of my skin is nice and soft, and I'm just back to like a normal routine. One of the things that I started using that I didn't have in the video, but I didn't receive it from Lumiere until recently. It's this intense recovery cream, and I love that. I'm going to talk to them about it and whether or not I can use it all the time. I'm really dry skin, so I might just make that a part of my regular routine. But super calming, has a nice smell, and hydrating. So anyway, thank you for joining me. Get your blue lights.